You've heard that COVID-19 has been devastating for African Americans, but just how bad has it been? We'll take a look at the numbers.
More than 20,000 African Americans have died of COVID-19. To put that in some perspective, if we take the annual mortality of African Americans and rank it by cause of death, COVID-19 already is the third leading cause of death for African Americans.
This is Dr. Trayvon Logan. He's an economics professor at The Ohio State University.
Only heart attacks and cancer will kill more African Americans this year.
Even before COVID-19 reached U.S. soil, it was harder for African Americans to access healthcare than it was for white Americans. In general, more white Americans have access to private insurance, which typically provides a wider range of coverage options. Black Americans who do have access to medical care often have to deal with racism within the medical profession. Studies from the last few years show that the pain of Black patients is taken less seriously than that of white patients due to implicit bias. One recent study even showed that half of white medical trainees falsely believe Black people have thicker skin or less sensitive nerve endings than white people. And there are barriers to African Americans even being able to see a medical professional in the first place.
African Americans in their occupational status are in and more likely to be employed in positions where they don't have paid sick leave.
Which brings us to the economy. We know that COVID is wreaking havoc on the US economy, but what you may not know is that under normal circumstances, you're already twice as likely to be unemployed if you're African American. And even among the employed, disparities persist in who gets to work from the safety of their home.
The people who cannot take themselves out of this network are those who will be exposed. Those are people who work in essential occupations, who cannot work from home, and who live with those who are also similarly situated. And we find that those people are disproportionately African American.
To put that in perspective, if you're Black in America, you're about 1.5 times more likely to not be able to quarantine during COVID because you're an essential worker than if you're a white American. But these disparities span industries. The number of African American self-owned businesses dropped by 41% between February and April of this year. In other words,
if there is going to be significant disturbance to the American economy, this would be absolute devastation to the Black economy.
One such person who felt the impact of these inequalities was George Floyd. After contracting COVID and losing his job, he was killed by a police officer in Minneapolis, sparking protests across the country. Protests that meant to highlight not just police brutality, but also centuries of racial injustice across the board.
I think a virus is almost like a pigment that sort of tells you where people are over or underrepresented. The people who cannot take themselves out of this network are those who will be exposed.